Importance of drug administration. Drug administration involves providing the patient with the prescribed substance for the treatment or prevention of a medical illness or condition. The method in which a drug is introduced into the patient's body is called the route of administration. There are different routes of administration based on the condition of the patient. Medicines are made in many forms and for many routes. Some medicines come in more than one form. Some can be given with more than one route if the correct form is used. The action of the drug within the patient's body depends on the quantity of the drug absorbed by the patient. The absorption rate of a drug depends on the route in which the drug is given to the patient. As a hospital assistant, you must be aware of all the routes of administration and ensure that the patient is provided with the medication at the right time in the right quantity. Routes of drug administration. Most medicines are prepared according to the route of administration that would be chosen for a patient. The prescription is a statement given by the doctor that suggests the quantity or the dosage and the method of administration of a drug. The prescription also states the number of times a drug has to be given. The different routes of administering drugs are as follows. Oral route. This is one of the most common methods of taking a medicine. The medicine is swallowed and absorbed through the digestive system. The absorption of the drug through this method is slow and it cannot be used for patients who have vomiting. Enteral route. In most child patients, the drug is given from the rectum. Such a route is called the enteral route. Mucosal route. In the mucosal route of administering a drug, the drug is inhaled with the help of an inhaler through the nose. Percutaneous route. Some medications are absorbed directly from the skin. This method is called the percutaneous method. Parenteral route. The fastest action of a medication is observed when the medication is delivered directly into the blood or any given part of the body. This is called parenteral method. Through this route, the medication is delivered into the artery, tissues beneath the skin, or abdominal cavity directly. Many of the drug administration techniques involve the use of special equipment such as syringes, catheters, IV lines, etc. The technique that needs to be followed is decided by the doctor, and the nurse usually follows the technique. As your duty, you should assist the nurse while a technique is followed by arranging for all the required equipment. Equipment used in drug administration. Drugs are manufactured in different forms, such as tablets, syrups, suspensions, and IV fluids. These forms have to be delivered into the body with the help of special equipment that is based on the route of administration that is chosen. Some of the common equipment that are used for the administration of the drugs include injections. An injection is a combination of a needle and a syringe. The drug is drawn into the syringe through the needle. The needle is then pierced into the tissue, muscle, vein, or an artery to introduce the drug into the body. Catheters. These are tubes that are used in administering the medication through IV fluids. The needle of the catheter is placed in the vein of the body and is used to create a channel for introduction and withdrawal of IV fluids. IV lines are long tubes that are connected to the catheter and a bottle of the IV fluid or normal saline solution. The drug is added to the IV fluid and through the tube, the drug is introduced into the body using a catheter. Nebulizer. Nebulizer is a special device that is used to deliver the drugs directly into the lungs of the patient. In addition to these equipment that are used for the drug administration, some medication in the form of tablets and syrups are consumed directly by the patient. You must check with the nurse about the route of medication that would be followed for a patient and ensure that all the necessary equipment is arranged for the same.